So there's a little technique that I do with some of my patients, and it really helps get the rib cage to drop down when there's this tightness. So when your rib cage is elevated, it's hard for you to move your shoulder blades and breathe too, but it can cause a lot of issues down your arms. So by lowering your rib cage, it really helps kind of get the blood flowing through your nerves and your arteries and your veins to your arms. So you can teach somebody at home to do this, and it's very simple. You just have them sit on the bed. The person's going to lie on the bed, and the person right here is going to sit in a chair. And I have the person put their hand on their stomach like this, and then you're just going to check the tightness of their upper shoulders. So you're just going to push down, and you want to feel how tight they feel. So somebody who's very tight and tense up here, their shoulders are not going to move much at all. So you want to see how much they're moving. And then you're going to check their arm. And you're going to see how high their arm will go. So there's a tension right here. And then you're going to try the other one. And this arm stops about right here. And then you're going to bring it back down. So now you're going to do the little release. So the clavicle bones are right here. This is the clavicle bone right here. And the clavicle bone right here. Just on the other side of it is the top of the ribs. And you take your thumbs and get them out of the way. And then I will lean forward, and then the patient or the person is going to take a breath in through their nose. And then as they exhale, and then I just push it down. And then you can see how she's jiggling a little better. And then I'm going to check the arm again. And you can see that she's going a little bit higher. So her shoulder blade's gliding better. And this one is too, going a little bit higher, but it's still having a little trouble. So you can do this a couple of times. So you just reposition. Here's the clavicle again. Come on the other side. Put your fingers right on top of the ribs. Lean a little bit. Have them breathe in. Have them breathe out. And you just push the ribs down. Now you can see she's jiggling a little more. And her arm is coming right next to your ear now. Up, around, and up. Now this arm is still a little bit tight. So if you wanted to do it one more time, again, you're just going to place your fingers on top. But this time maybe a little bit more on the right side. So you lean in, breathe out, and maybe a little bit more on that right side. And then recheck the right one, and you can see how that's gliding a little better. So that's how you can do that to somebody else, or they can do it to you.